Hi, I'm Christian Brindle, and welcome to the Everything Medicare Podcast. What's up, Everything Medicare Podcast Nation? This is Christian Brindle. Thank you so much for joining me on a Saturday. Every single week, I bring you 3 podcast episodes where we discuss your Medicare, your Medicaid, your Social Security, and everything that has to do with that golden age called retirement. If you don't know who I am, my name is Christian Brindle. I've published 2 books on the topic of Medicare. I've been hosting this podcast, the Everything Medicare Podcast, for about 1.5 years, close to 2 years now. And it has become the number 1 or number 2 rated Medicare podcast on every single podcast platform on the internet. And thank you. Thank you so much for listening all this time. If you've been listening from the beginning, I hope you've had a tremendous amount of assistance and help in making proper decisions on your Medicare health plan along the way because of this podcast. I hope we've been able to help you quite a bit. I own a company called Christian Brindle Insurance Services where we work with people just like you of all different situations on their Medicare health plan. We partner with some of the largest insurance companies in the insurance industry to help sort through people's options that they have available to them when they're on Medicare to help them find the best available fit based on their needs and preferences. I've said it before and I'll say it again. Medicare is not a one-size-fits-all, folks. There is not one particular plan or one particular route of doing your Medicare health plan that is going to be the best fit for every single person out there. So it's really important to have a Medicare specialized representative backing you. My company works with people for no charge of any kind, no obligation. We get compensated from the insurance companies to provide you year-round service to any person that does a plan through us. But we're not talking about me today. Today we're talking about the enrollment period. Earlier this week was October 15th, the official beginning of the Medicare enrollment period where you can make changes to your Medicare Advantage plan and your Medicare prescription drug plan going into the next year in 2020. But starting on October 1st, the changes for next year of all of the different insurance companies for Medicare Advantage and Medicare Part D prescription drug plans were announced to the public. And in my opinion, I've been doing this for a long time. I've been through a lot of Medicare enrollment periods. I grew up around the insurance industry. For those of you who know my story, my dad was one of the early pioneers of Utah Medicare here in Utah. There weren't a whole lot of people doing Medicare and straight Medicare, and that's it. Back in the late 80s, early 90s, when my dad kind of pioneered the Medicare industry locally here. But I've seen a lot in my time. I like to think in this topic, I don't know too much about too many things, but I know a tremendous amount about insurance and a tremendous amount about Medicare. Don't know much about too much else, including, proper grammar and proper English. I don't know much about many other things, but Medicare is something that I know a tremendous deal about. And I could make the argument, based on the changes going into next year, that this Medicare enrollment period has brought forth the most changes that we have ever seen nationally at one time. Ever. Of all time. With the exception of the first Medicare open enrollment period when Medicare Part D and Medicare Advantage plans first came into the fray. I think that probably would take the cake over this. But with the exception of that, because in 2005-06, when Medicare Advantage and Medicare Part D prescription drug plans came back into the fray, before that point, the only types of Medicare plans people could really get at that point were Medicare supplements, maybe some ancillary products like, dental policy, something like that. But before that point, the only types of plans people could get were Medicare supplements. So of course, a lot of people wanted to get Medicare Part D prescription drug plans, Medicare Advantage plans. I wasn't around in the industry at that time, but my father was, my dad was. And he described it as the busiest enrollment period you can ever imagine. So take that enrollment period out of the equation. Every enrollment period since then, I would make the argument that this enrollment period has brought forth more changes than any enrollment period before. I'm incredibly tired, folks. I'm fatigued. I'm working anywhere between 90 to maybe 100 plus hours a week during this time of the year. If we were a tax office, this would be our tax season, because we have a lot of people we got to take care of. There's a lot of demand as well, a lot of people that want to work with my company. It's a busy time for us, so I have to drink my coffee. So I'm drinking this Starbucks coffee. It's seasonal. For those of you coffee lovers out there, it's basically cold brew black coffee. I believe it's black coffee. I'm not a coffee expert, so don't crucify me if I'm wrong there, but it's a basically black coffee with some pumpkin spice foam at the top, And this time of the year, I love the seasonal coffees, But main thing is it helps me be sharp, energetic, and entertaining for you. And so, forgive me, I'm just going to be sipping my coffee as we talk and have this conversation. It helps out a lot. It helps out a lot. It really does, folks. So, why is this Medicare enrollment period so busy? Well, let's talk about that. Let's talk about what makes an enrollment period busy. And in my opinion, there's 3 possibilities that could possibly play a factor. Number 1, there's dramatic changes to the plans. Dramatic changes to the plans. And that would be, Medicare Part D plans dramatically changing, They're changing their premiums, they're changing their formularies, they're changing deductibles, and all different kinds of factors. Medicare Advantage plans changing their networks, changing their benefits, increasing benefits, lowering benefits, adding new benefits to the equation, taking benefits away, raising copays, lowering copays, etc., 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 changing their network dramatically. Those would be changes, big changes, that could affect this criteria. The other thing could be Medicare Advantage plans being available in new markets. As Medicare Advantage goes on, it's always gotten more popular over the years, and as it gets more popular, you'll see it expand into new areas that it wasn't before. Medicare Advantage is not in every county in every state in the United States of America, but it's slowly but surely getting to the point where it will be. I love coffee. I do, folks. I love coffee. And I desperately need it this time of year. So that would be the second aspect. Medicare Advantage plans expanding into new areas that they weren't available before. So, if they expanded into a new area where there wasn't an Advantage plan prior to that, the only type of plan someone could get would be a Medicare supplement and a Medicare Part D drug plan. And so, all of a sudden, those people have new Medicare Advantage options that they didn't have before. So that affects the market and the volatility of everything pretty dramatically. That would be the second reason. The third reason would be Medicare Advantage plans canceling people and pulling out of counties, which happens all over the country. Does it happen tremendously often? Is it happening with every company, every type of plan? No. Every state? No. Every market? No. But it does happen every year in some areas or another where an insurance company determines that they're not profiting the way they'd like to in a certain market. So, what do? They completely pull out of that specific county or maybe even a specific state. And when they decide to do that, well, I guess the technical term would be, instead of pulling out, they would be non-renewing the plan at the end of the calendar year. Because Medicare Advantage plans, folks, are based off of a yearly contract, calendar year contract. They're contracted to provide you coverage if you're enrolled in that plan till the end of the year, but they don't have to renew it at the end of the year if they don't want to. And sometimes Medicare Advantage plans do that in rural counties specifically a lot of times if they feel like they're not profiting the way they'd like to. And so that would be the third reason. So, the 3 reasons would be benefits changing on Part D plans or Medicare Advantage plans, number 1. Medicare Advantage plans entering new counties that they weren't before, number 2. Number 3 would be Medicare Advantage plans pulling out of counties. Okay. I'll talk about which one of those are happening this enrollment period, and I'll share as much information as I can without mentioning any specific companies by name. Let me take a break. Hear from our sponsor, Randy W. Hall, the Mr. Nice Guy Medicare Advisor, and I'll be back with you in segment 2, and we'll break down exactly what's going on this year and what you need to watch for. Don't go anywhere.
What's up, everybody? This is actually Randy W. Hall, Mr. Nice Guy Medicare Advisor, not Christian Brindle, your esteemed host. I'm here to tell you about my Medicare agency, Mr. Nice Guy Medicare Advisor, based here in Tennessee. For the past 10 years, I've been helping Medicare beneficiaries just like you in Tennessee and Kentucky maximize their Medicare. If you're a regular listener of this podcast, you know Christian always encourages you to deal with a broker in your state who sells all the different plans and will give you not just a quote, but also advise you and educate you in a way that is simple to understand. We know how confusing and overwhelming the whole process can be. We do it all for folks on Medicare, from supplements to Advantage plans, Part D, cancer products, hospital indemnities, and more. So if you want to get a free quote or a consultation, I urge you to call 615-578-5174. Again, that's area code 615-578-5174. Or for more information, you can visit my website and read all about me at MrNiceGuyMedicareAdvisor.com. That's all one word, MrNiceGuyMedicareAdvisor.com. And again, why deal with a jerk when you can deal with a nice guy?
Ha! Welcome back, everybody. Thank you for that message from Randy W. Hall, the Mr. Nice Guy Medicare Advisor that helps people with Medicare in the states of Tennessee as well as Kentucky. This is a good guy, folks. This is a guy that has integrity. This is a guy that has the knowledge, the experience, the expertise to make your life easier in those specific areas. I'd say he's a top option for you this enrollment period. And specifically speaking, because my organization is not licensed in those two areas. So it's always great to be able to have a recommendation for you to possibly get in touch with this in Medicare enrollment period, okay? So let's get back into this. Market volatility is the topic of this week's episode. Today's episode. I'm never going to get used to referring to the podcast as 3 times a week. It's still unbelievable that we're doing that, and I can't believe we're able to even keep it up during the Medicare enrollment period, but I can't do it without my coffee. Oh. I mean, will I run out of gas before the end of the deadline? Maybe. I don't know. Hope not. But I have a passion for helping people just like you on their Medicare health plan, for providing information for free. We don't charge anything. We put out more information than anybody in the United States of America for free. That's a fact. I challenge anybody to put their information or their content up against ours and who gives away more information for free in more detail. I don't think there's anybody that comes close to what we're doing here. So, market volatility. Okay, so this enrollment period, I can't mention any specific insurance companies by name because it would look like I'm endorsing a company or I'm recommending a certain company or I'm saying this company is so bad because they're changing things. So I'm going to do my best to dance around that. I know everybody likes to see me dance around things, try to not say anything that's going to get me in trouble, but here it goes. Here's my best attempt. This enrollment period, there's been a dramatic amount of changes to the Medicare Part D prescription drug plans. I mentioned what was going on in a couple episodes ago with Aetna selling their Medicare Part D drug plans to WellCare that takes effect January 1st. So that just changes every single person from they had an Aetna drug plan this year, next year it's going to be a WellCare drug plan. This doesn't affect Medicare Advantage or Medicare supplements with Aetna, but just Medicare Part D drug plans. The only reason why I can mention those two companies by name is because this is public knowledge. Everybody knows that. So that's a big change. Big change. There's a lot of people on Aetna Medicare Part D drug plans in the United States. Whether they like it or not, they're changing to WellCare drug plans next year. And if they don't make a change to their plan, let's say if they don't like that change or they don't want that to take effect, they have to change it. Otherwise, it will automatically take place starting January 1st. So we have that. But then also, probably one of the largest Medicare Part D companies next year is changing their drug plan specifically. They are taking a national plan that is incredibly popular. They're rolling it into another drug plan next year that in a lot of markets, not all over the place, but in many, many markets, the premium will be doubled for almost the same plan, if not a little bit worse coverage. And then they're rolling out a new plan that people don't automatically get that's similar to the old plan that's lower premium. And if people want that, they have to enroll themselves into it. If you're an agent and you're listening to this or you're affected by this change, you might know which insurance company I'm talking about. They advertise like crazy. They have commercials like crazy. And when I found out about this change, believe you me, I had a heart attack because of all the people that were impacted by us. But we've gotten with everybody. We've helped everybody, I believe, to make sure that we revisit this. Okay, but basically, those plans doubled in premium in many markets, don't get any better, and there's better, cheaper plans available for many folks. So that happened nationally in many, many markets. Tremendously big deal. There was another Medicare Part D drug plan that had, in a lot of markets, not everywhere, but in a lot of markets, very reasonably priced Medicare Part D drug plans that had no prescription drug deductibles. People liked that. People don't like prescription drug deductibles. Well, next year, nationally, that company is adding drug deductibles anywhere between $200 to $400+ on their plans, and that's impacting people heavily. This is also a very large Medicare Part D drug plan with millions of people on it. So you have three companies that probably eat up about 50 to 60% of the market share of Medicare Part D drug plans together, changing dramatically, incredible volatility. So we've had a dramatically chaotic Medicare Part D drug plan year. And there hasn't been as many Part D drug plans to choose from, to be honest with you. Not as many as we've had in years past, I'd say. At least in the markets I work in. So there's that. Also, Medicare Advantage plans have been expanding dramatically going into next year. Medicare Advantage plans expanded into anywhere between 100 to 200 additional counties that they weren't in starting next year, January 1st. So, Medicare Advantage plan is going into more areas. I read an article that said that they believe that United Healthcare will have a Medicare Advantage plan that's within reach to 90 to 95% of Medicare eligible people. That's huge. That means 90 to 95% of people in the country will have access to a United Healthcare Medicare Advantage plan specifically. After these changes, Aetna entered a bunch of extra counties with their Medicare Advantage plans going into next year that they weren't in. Cigna is another company that did that. So Advantage plans expanding nationally into additional counties where they didn't have Advantage plans before. So Medicare Advantage expansion. That is dramatic. And Medicare Advantage plans always change their benefits from year to year. Like clockwork. Sometimes they get better, sometimes they get worse, sometimes they add benefits, sometimes they take benefits away. But that is something that does remain consistent year after year after year. Some plans change more than others. And it depends on the year. Some years, some plans don't change much. Some years they fall off a cliff or they climb up a ladder in their benefits. If you're on a Medicare Advantage plan and you're listening to this, and you're on a Medicare Part D drug plan and you're listening to this, chances are you've been impacted by some of these changes. This has been the most chaotic year for changes, the most volatility that I have ever seen, ever, in the Medicare world. from top to bottom, factoring everything into consideration with the exception of the first Medicare open enrollment season. Don't go anywhere. Let's take a break. I'll be back in segment 3 after a quick word from this week's sponsor. I will share my final thoughts on this. You're not going to want to miss what I think and what I have to say. Don't go anywhere! Welcome back, everybody. Thank you so much for sticking with us all the way to the end here in our third and final segment. My final thoughts on this topic are simple. Do your research, do your homework, get with a good agent in your area, or just get with my company if you live in Utah, Texas, Idaho, Oregon, and Florida. Those are the 5 states, that my organization is licensed and appointed with multiple different insurance companies to work with people on Medicare of all different situations. Get with my company if you live in one of those 5 states. If you're not in one of those 5 states and you're in one of the other 45, get with a good agent that you can that can help you, that you know will be there for you long term. Make sure that you're not impacted by one of these changes. Make sure that you don't have a better option on the table. Simply put, but you need to be aware of what's changing. Because if you're not aware, you don't know what to look for, and I hope after listening to this now that you do. My office number is 801-255-5340, 801-255-5340. Again, my name is Christian Brindle. The name of my organization is Christian Brindle Insurance Services, and I appreciate you listening. If you're listening to us on a podcast platform that allows you to leave us a review, please leave us a 5-star review. It helps us reach more people just like you who need to hear this information, who desperately are confused and don't know what to do. You can be the difference to help them find those answers. By leaving us a review, it helps the algorithm out. It helps us reach more people just like you. It helps people find us easier. Thank you, folks. Thank you for being committed to your education and to yourselves. Have a great rest of your weekend. I'll be back with you next week. Bye-bye.